Uh, this is Dr. Gashinsky from Holistic Dental Center in Milburn, New Jersey. And I introduced to you Kenyon Keily, who is a herbalist, who just knows about the herbs. He just lived natural life. And he really researching what's going on around. And I want to ask you a few questions about the coronavirus. And the question is going to sound a little bit strange, but what's your perspective on the reality of coronavirus? It's a myth, facts, and what your patient concern and what you're finding.
Okay, so my method, just hang on a moment. So my approach to coronavirus would be, first of all, prevention. You know that whole saying that an ounce of prevention is worth a ton of cure, right? So it definitely applies. And so that comes down to not just taking a remedy, which everyone wants the remedy. What remedy do I take to prevent or treat? So before I answer that, I'd like to first say the first prevention is the most obvious things, which is eat healthfully. Don't be going around consuming ice cold drinks, have warm drinks. You're a warm body and consume warm drinks, warm food. This is winter. So you don't want to be eating raw food. You actually, in my opinion, want to eat a warm cooked diet suitable to the season that we're in. That takes stress off the body. You want to make sure you're consuming plenty of warm fluid. A lot of people under-consume fluid, so they're basically dehydrated all the time. So those are the two very fundamental things. I talk about things like ginger tea, very simple things. Warm tea that actually keeps your body in a warmer place, because viruses, they don't like warmth. That's why they produce a fever, or your body produces a fever to combat a virus. I believe you don't kill the fever, you only control the fever. If the fever gets too high, you do things to control it. But having a low-grade fever or a mid-grade fever is your body working to kill the virus, right? Because viruses don't live healthfully in a body that is actually slightly warm. So keep your kidneys covered. Wear the right clothing if you're going out. Make sure that you're warm. Be slightly overdressed and peel off layers rather than wishing you had an extra layer. So just sensible, basic protection, okay? Then when it comes to the herbal remedies, so you could either buy over-the-counter antiviral herbal remedies. Remember, I'm an herbalist, so I think herbal. The only thing I've advised people outside of herbal remedies is vitamin C. And if they're going to do vitamin C, I tell them to do 3,000 milligrams a day for prevention. 5,000 plus milligrams a day if they're in a treatment phase. Personally, I don't take vitamin C. I'm really an herbalist who consumes herbs in order to treat or prevent. So I have a formula, which I think you're familiar with, which is called anti-invader. That formula has in it a herb called skullcap, bicol skullcap. All right, Scutellaria bicolensis is the Latin name. That was one of the first herbs that showed up in the information coming out of China in terms of herbal treatment formulas. That's another thing, that I treat with formulas rather than single ingredients. I see a lot of people when I look on the internet using single ingredients for treatment. I think you're far better off using a formula, because a formula is so complex that a virus can't unravel it in order to combat it. It can only succumb. We know that that's how modern germs are able to overcome modern medicine, because of the fact that they use singular ingredients in concentration. A single herb is not just the active ingredient, it's a myriad of ingredients. When you make a formula, now you've got exponentially so many parts to that formula, the virus can't figure out how to combat all those parts. So I think having an antiviral formula, prevention and treatment. So the only difference between prevention and treatment is dosage. So first step. Second is if you actually get the infection, you go to treatment doses. And this particular virus, it appears, attacks the lungs. You hear that, it's pneumonia-like. You have phlegm that's very sticky and stuck in the lungs. People have difficulty breathing. So I have developed also a herbal formula for the lungs. There are several, again, that are out in the marketplace that you could choose, but it's about having a formula that will specifically resolve this sticky kind of phlegm. So one of the ingredients that I think is critical in this is a herb called Grindelia, which grows out in the Midwest. And it's incredibly helpful to dissolve and resolve sticky, hard to get rid of phlegm. So it treats things like asthma, pneumonia, right? So remember, those are Western disease names, but these herbs are known historically for doing this type of work. I could list off, give me one moment and I'll just give you an idea. Types of herbs that I'm using in formulas, all right? Grindelia, mullein is another herb that supports lung health. Hyssop, so people who know their herbs are going to know these very quickly. Inula or elecampane, these are herbs that dissolve sticky, phlegmy mucus. So some of these herbs also begin to dissolve that mucus in the stomach. In order for you to get mucus in the lungs, you have to have a little bit of poor digestion. If you're not digesting your food well, you always have a little bit of mucus floating out throughout your body. And so there's always, for me, herbs like angelica, it's called angelica, archangelica, and elecampane begin to dissolve the mucus at the level of the stomach digestion. Then you have herbs, those same herbs and other herbs, working to dissolve the mucus in the lungs and actually helping to support lung health. The reason for taking, so in my formula, the anti-invader formula, there's antiviral and antibacterial. I've always made my formulas so that both sides are covered. Why? Because they discovered and have since scientifically shown that viruses can live inside of bacteria. They found viruses in bacteria inside of spirochetes. I find that pretty fascinating. So for me, having a formula that covers both viruses and bacteria makes the most sense, not just one-sided, not only treating viruses. So at this point, I'm mostly working with people who are looking to prevent. And I just like 4 days ago, had the first case present with an actual diagnosis of COVID-19. And I just got another case this morning, actual diagnosis. So give me another 5 to 7 days and I'll have a response, being able to tell people what the results of treating with these formulas are.
Basically, expect the call from us in 7 days, because we
Yeah.
want to know how the results work, what is working. Because I have your formula, you know, that
Yeah.
anti-invader, and I'm taking it as a prevention.
Yes, and that's basically what I'm doing also.
Okay.
And so I feel very confident that if you do prevention, there's a good chance you're never going to get infected anyway. I've actually gone through whole winters without getting sick because I do preventive treatment. There is one formula that is a great preventive formula from Chinese medicine. You'll see it online. It's called Jade Screen. The company that I like the most, it's Seven Forest brand. So there are other brands out there. It doesn't matter which brand you use in one sense, except for there are issues around the quality of herb material, company to company. So yes, there are other good companies out there, but there are also companies out there that have rubbishy material, which I don't want to promote, right?
I understand,
So
because you're responsible.
yeah, right across the board, you always have to investigate the company quality, what kind of quality material, what are their manufacturing processes, etc. So at least I know, having used this particular formula for over maybe 20 years now, that it's a reliable preventive formula. If you get sick, you stop taking it. This is something that people don't seem to get. They're taking like immune strengthening formulas. They forget the fact that if they get sick while taking it, it now makes it harder to get rid of the virus because you have a strengthened immune system called your defensive immunity that locks it in a little bit. So once you get sick, you stop your immune building and you go to treatment. Soon as the treatment has shown resolution, you go back to immune building. Make sense?
Now it makes sense. Because
Otherwise,
people unfortunately taking everything.
Yeah, otherwise people take everything and you don't have to.
Yeah, and I'm, for example, is a perfect example. I take anti-invader, I take vitamin C.
Yep, and that's
This is I believe this is good for me unless you tell me not.
that's how I feel about it. They take the least amount of remedy to resolve the issue, right? Because then it actually has every opportunity to work. If you take too many remedies, your body's trying to utilize all of those components and it occupies healing energy. If you just take the specific treatment to deal with a condition, then all the energy's going in one direction.
Wonderful. Yeah? Thank you very much. And the last very, very difficult question, what is your expectation for the next few days, few weeks?
So in terms of how long this is going to be around?
Yeah.
So I have a lot of people in the herb world who I also follow. What are they up to? And so we've already seen that in China, the COVID-19 went up and down within 6 weeks. So it raised and now it's gone down and we're at 2 months and it's actually fading away in China. So I'm expecting similar patterns here, similar patterns everywhere, that it looks like it's about a 2-month cycle. Will it raise its head again? We don't know, right? We have no idea.
Yeah.
But there's a good chance that it will go out with the warmer weather, like all viruses tend to. And then in the fall, maybe we see another wave of it, or maybe not. This is a virus that's unknown. This is not like, we can't just assume that it's like every other virus, simply because this one we've never studied. We're studying it as it happens. So I have faith that it will fade away as the weather gets warmer. We might see it again in the fall, we might not, but just do the preventive things. Be ready, be prepared. How else can we behave, right?
Thank you very much. It was very, very informative discussion. I really appreciate it. Basically, this is very important for our listening. We just recorded it and we try to distribute to the people. Thank
Absolutely.
you very much again.
My great appreciation, my friend.
Bye-bye.
Bye-bye.